presentation, Dr. Riba, as one of the thank the Dr. Abada and the organizing committee for inviting me to share this elegant meeting. We'll speak today about the balloon microplasty, single balloon or double balloon. Years ago, the balloon microplasty is the treatment of choice for tight mitral stenosis, either single or double balloon, compared with surgery, either open or closed mitral commissurotomy, and especially on long run. Let us share this case with very high Wilkins score, tight mitral stenosis, and contraindicated for surgery. The mean pressure gradient almost 50. What we will choose for this patient to do it with a single balloon or double balloon. Let's compare between the both balloons and reach finally the answer. The single balloon historically started by Illinois in 1982. He performed one septostomy. He needs no wires inside the LV. The balloon goes inside the LV by itself. The double balloon started by Mu'ayyad Zeba at 1986. He performed two septostomies. He used two wires, two balloons to perform the balloon mitral valvuloplasty. Then the technique modified again with Igor Palacios. He performed just one septostomy, but still two wires and two balloons. Lastly, at 1993, Philip Berhofer in Kenya performed one septostomy, one wire, but still two balloons. About the pressure developed on the balloon, in the single balloon, the pressure all over the mitral will expose to the pressure and the strain. But in double balloon, the pressure focused on the commissions. Again, the strain developed by the balloon, coded by red, is much more high in the single balloon than the double balloon. But unfortunately, the length of the double balloon is much more longer, about 10 centimeters from the tip to the end of the balloon, compared with the Illinois when deflated 2.5 centimeters and when inflated 5 centimeters. And this is the point of the difference. The problems come from this part, from the wire, and from the part beyond the tip of the balloon. All the problems arise from the double balloon, mostly related to this part. Again, the Illinois safety is much more higher than the double balloon. Many factors for the safety. Safety thread inside the balloon to prevent the elongation of the balloon when inflated, and safety vent to deflate the balloon in situations, and safety hole to deflate again the balloon if not deflated. And about the rupture, very large safety. The rupture started at 6 kilometers per cubic centimeter, but we need only 2 kilometers to split the commissions. Again, the Illinois is a flexible balloon. One needs used is a loop method, but the double balloon is a non-flexible balloon. The technique of the inflation, the Illinois, we inflate it stepwise, so we can gain different pressures by gaining different volumes. But the double balloon just inflated once and get the result. Calculation of the size of the Illinois depends on the height of the patient, but of the double balloon depends on the annular diameter. About the procedure itself, the Illinois is much more shorter procedure time, about 25 to 50% of the double balloon. And when we inflate the balloon, just for 2 to 4 seconds. So the maximum occlusion of the circulation is very short compared to the double balloon. The double balloon is a demanding technique. You need a learning curve, you need an experience. We will come to the result. Both techniques have the same results. The the same success rate, either the Illinois or double balloon. And the post-procedure mitral valve area, almost comparable, started from 1.8 to reach 2.1 in both techniques. Some studies show that the double balloon get a higher mitral valve area than the Illinois balloon. But these studies usually small number of patients included. Again, about the hemodynamics. The hemodynamics post-procedural, as regards the pulmonary active pressure, the mean left pressure, the LV and the diastolic pressure, and the pressure gradient almost comparable between both techniques. Even when the studies showed a wider mitral valve area, the hemodynamics are equal in both maneuvers. This study showed the mean pressure gradient is much more lower in the double balloon, but still just 20 patients included. About the long-term results, it's not related to the type of the balloon used, single or double. It is related to presence of commissural, mild commissural regurg. If mild commissural regurg is present, we'll get a very long term of success without re-stimulus. Also, the initial success gives a very long term of prognosis, good prognosis. Plus the complications, it's more in the double balloon. This is a meta-analysis performed in Egypt of the thousands of patients included. The complication rate in the double balloon almost 20-something, and the Illinois just 7%. With individual complications, effusion, arrhythmia, ambulance, embolization, and death, more in the double balloon. As regards the development of mitral regurg, the mild and moderate mitral regurg more in the Illinois, but the significant severe mitral regurg is comparable between both groups. The hemopericardial and the hospital mortality more with double balloon, and also air embolization during rupture of the balloon. Lastly, there is a specific technique-specific complications. The tear of the anterior mitral leaflet is specific for the Illinois. Fortunately enough, it is very low incidence. And the apical perforation is a unique for the Illinois double balloon, the multi-track double balloon. Again, fortunately enough, the incidence is small. The slipping of the balloons in the Illinois indicates success by the slipping of the balloons in the multi-track or double balloon indicate the valve is still small and you need to perform more dilatation. Lastly, the cost of the Illinois is more expensive, about 40% compared to the double balloon, and according to the safety and short procedure time, certain scenarios will prefer usage of the Illinois balloon, pregnancy, small LV cavity, pediatric age group, high Wilkins score. And lastly, no more multi-track balloon will be available according to the MDR regulation. Back to our patient, we performed the patient using the Illinois balloon, and pressure dropped from 50 to 80, and the commissural lateral commissural is moving. Take-home message: balloon mitral valvuloplasty is the standard technique for treatment of traumatic right atrial stenosis. Single balloon has shorter procedure time and more easy to need. Both single and double balloons have comparable results of success, mitral valve area, and hemodynamics. High complication rate is double balloon compared to single balloon. High cost of single balloon compared to double balloon, and no more multi-track balloon will be available. Thank you.